board meeting of the CQC. We have no apologies for absence. I'm very pleased to welcome Harriet Hammerston, who is the co-vice chair of our Carers Network. It's unfortunate that we didn't get the timing right, Harriet, because obviously last week was Carers Week, and it would have been great if we'd managed to coincide the meeting with it. But anyway, you're extremely welcome. Does anybody have any declaration of interest to declare? Okay, so then we move to the minutes of our meeting of the 20th of May. Are they a true and accurate record of all we discussed?
Peter, I think they're a true and accurate record. There's just one matter arising I'd like to raise on page 5 of 67 in the pack, which is page 2 of the minutes. It references the Insight report, and I said at the board last time that we'd be producing that every fortnight. We've now decided to produce that every month and align it with board meetings. So it's just a matter arising rather than an inaccuracy. Thank you.
Fine, thank you very much, Ian. So I think we'll approve the minutes. Was there anything else arising anybody wanted to raise? Okay, so there's nothing else. Then let's move on to the ET report. Ian, you're on mute.
Apologies. I thought I'd taken myself off. So as you would expect, COVID-19 still dominates all aspects of our work and arguably still of our lives as well. I think I think one of the key points I wanted to make to the board this morning is that although there is much public discourse around things getting back to normal, and this slightly binary argument that either things are normal or things are in an emergency state, I think we do need to recognise that they are not normal, and that COVID is still present in a number of settings, and particularly in a number of settings that we regulate. And so therefore we need to be mindful when we're thinking about how we resume inspections and how we start to physically go and visit places, the impact that we might have as an organisation, as people. There are, of course, fears of a second peak, and that's widely talked about. And I think it is important that we report on what we are hearing on the ground. Some things do still need to improve, undoubtedly, in terms of the way that some providers are offering services. But I think it's also really important that when we report on what's going on the ground, we make a contribution to talking about good practice and the very practical innovation that we see on the ground. I think sharing that good practice, that innovation that we're seeing, is really important, because it means that providers can play their part in reducing the impact of any subsequent surges in the virus. The other thing that's happened in the last period is Kate Taroney gave evidence recently to the House of Lords Committee on looking at the impact of COVID-19, and also we carried out a pulse survey within our own teams to understand how we're getting on and how our own teams are feeling. Although the results of that pulse survey are covered in full in the agenda later on, I'm really pleased with the results that we've had. We've tried as a leadership team to create a sense of community, a sense of community with a job to do, but also a community that looks out for each other. And I think the pulse survey results reflect that we've had some success in doing that. I think, as ever, there is clearly work to do, and there are some areas where we know we need to keep working really hard. But I think I'm really pleased that in a time of enormous personal uncertainty for all of us, and for everybody that works at CQC, I think people feel a sense of connectedness to the organisation and feel a sense that the organisation is looking out for them as an organisation, but also people are looking out for each other during this time period as well. So I think I was really pleased to see that as a particular theme. In terms of upcoming work, I think, as you'd expect, we will be stepping up our regulatory activity. And that regulatory activity will take many forms. It's not just numbers of inspections. And I think we've talked about this as a board before, that our actions as a regulator are many and varied, and involve remote viewing of information and acting upon that, as much as physically crossing the threshold and carrying out a conventional inspection. We do need to make sure that as we are entering more and more premises, that we do that safely, both for our own teams, but also for patients and people being looked after, as well as for the staff that work in those settings. And again, we're very mindful of that. Internally, our transformation work continues. We've really carried on a lot of the really important work we were doing around transforming the organisation whilst we've been in lockdown, and that work will be continuing. And I think the way we've been able to do that remotely is a real tribute to Mark and a number of colleagues who've given us the digital infrastructure, which has enabled us to do some really fantastic things during this time period. We will continue also, I think, our organisation-wide calls about the impact of COVID on people from Black, Asian and minority ethnic backgrounds. This is something we've been talking about for a while in the context of access to services, but I think it was brought into sharp relief in recent times with the sad death of George Floyd in the United States. And it's again the issue of equality and inequalities has obviously been raised in the public consciousness again, and it's just as true in the health and care sector as it is anywhere else. So again, what we want to do is to continue our work to raise this issue in a constructive way, so that we can be both a good regulator and of course a good employer, and we will be continuing to do that over the next period as well. So that's all I've got to say, Peter, before handing over to Kate for the next item.
Thanks, Ian. Kate.
Okay, so thanks all. I'm going to talk to you first about the emergency support framework in adult social care. So you'll remember that this is our kind of structured way of having monitoring conversations with providers that was developed at pace since the start of COVID. Adult social care was the first sector to go live with it. So we went live with it back in beginning of June. As of the end of last week, we had completed over 5,000 emergency support framework conversations. That's about 18% of our services in adult social care. The significant majority of those providers were found to be managing, and that is managing when we were looking at it through the kind of quite narrow scope about how the provider was responding to COVID. In the small number of cases where providers were flagged as needing support, my heads of inspection, deputy chief inspectors and myself have had eyes on the actions we've taken with those needing support providers that have ranged from a provider flagging an issue because they were unable to access personal protective equipment and the work we did with the local authority or other providers to share kit out, through to us being significantly concerned, and despite looking for assurances from local authorities and other stakeholders, we have brought forward an inspection and gone out and crossed the threshold. So there's been a spectrum of things we've done in response to those needing support judgments about following the emergency support framework. Throughout the whole of COVID, we have continued to go out and inspect services where they were of significant risk. That is shifting now to services where we have concerns. So originally it was around services where the balance of our inspectors going out and the potential risk of them walking an infection into a service, where the risk is greater for us to have needed to actually cross the threshold. So in the last 2 weeks, I have been authorising an increasing number of targeted and focused inspections for services. And the work that Ted will talk to you about in a minute, our inspectors now are proactively reviewing their portfolio. So looking at their providers they've got in their portfolio against an organisational agreed set of priorities around things such as, have we previously identified this as a closed culture? Is it a service with a history of concerns around quality? What does safeguarding and whistleblowing and give feedback on care tell us? And we're asking our inspectors now to prioritise those services that they need to start going out to in the coming weeks and months. So that's an active piece of work that's happening now. And with regard to whistleblowing and how critical it's been to continue to hear from the public and staff about what's going on out in the sector as we've been less physically available with crossing the threshold. We've seen an increasing number of calls that have come into our contact centre. And the bulk of them, about 75% of the kind of concerns that have come in have related to adult social care settings. So to put this into context, from the beginning of March to the end of May, we saw a 55% increase in the number of calls in comparison to 2019. So these are kind of pretty significant numbers. And just to give you the flavour of what is being raised with us, so about 26% of those calls were around personal protective equipment. And I've already described some of the things we've done to help address those issues for providers. About 32% of them were about infection control and social distancing. And there's a suite of other things in it, but also wanted to flag about 4% of them have been where people have raised concerns about the quality of care. And in those instances, we have had direct conversations, as you would have expected, with the providers and taken action as and when needed. About 50% of the physical inspections we've done, predominantly in adult social care, but also across to hospitals and to primary medical services, have been influenced, informed, triggered by feedback we've heard from people out there in the workforce and members of the public. So just as another opportunity, we've got to give feedback on care. It's absolutely critical. If you're receiving care, or if your loved one is, or if you're a worker out there working in the health and care sector, we really want to hear about it. And we don't just want to hear when it's working fabulously well or disastrously. We want to hear the spectrum of services and experiences people are having. And then the final thing I just want to say in terms of regulatory activity. So during COVID, we have not stopped, where appropriate, our ability to take enforcement action and to see cases through to conclusion where there's been a court outcome. And one of these pieces of work concluded last week. So we had a provider down in Portsmouth delivering home care. They sought to be registered with us. They didn't meet the standards of quality expected at registration. After a process, we ended up in court, and we were successful last week, and one of the largest penalties have been issued covering fines and costs. So we have absolutely, during COVID, continued to take legal action as and when required to ensure people receive safe care. So that's a bit about COVID and regulation. And just to give you one other brief update from an area of responsibility that sits under my patch, so restraint, seclusion and segregation and closed cultures. So this board is very familiar with the work we've done around restraint, seclusion and segregation. And you'll also remember that in discussion with our families who have worked really proactively with us to help shape the recommendations of this report, there was a collective view that actually we wanted this report to land when it would be given the impact and the action that it kind of is warranted because of how important the issue is. So we're ramping back up that activity over the summer to really finalise and firm up those recommendations, and we look forward to publishing it in early autumn. And the closed cultures activity, so the wealth of activity that sits under this work stream around things such as supporting inspectors to identify what a closed culture is, providing inspectors with training and guidance through to surveillance and a whole wealth of stuff in between. This programme board is making good progress. So we have done mandatory training for all of our staff around human rights. As of the 22nd of June, we are requiring all of our regulatory staff to undertake training around our revised supporting guidance about closed cultures. This was guidance we put out in autumn. We've now had a bit more time to get feedback, to involve families and stakeholders, and we've got a refreshed version that we will be publishing next week alongside some robust training on that. We're doing some work with University of Warwick around positive behavioural approaches and how we can understand that and think about that when we inspect. And finally, our emergency support framework has enabled us, the kind of functionality it's given us, has enabled us to be far more effective at drawing together all the different strands of intelligence with one lens being, is this a provider we need to flag as a potential closed culture, and therefore adjust the way we prioritise and inspect it accordingly. So that's an update on that piece as well, Peter.
Thanks, Kate. I mean, I do think it's really impressive just how much work has been going on across every part of CQC over the last few months, and congratulate everybody involved. Are there any questions or comments for Kate before we move on to Ted? Right.
Just a quick.
Oh, sorry.
Sorry, I was just going to do just a quick comment on behalf of the Joint Network Voice that we've had very positive comments about the EDHR training, and I know that the closed culture training has been developed for inspectors, but I know that myself and other analysts in intelligence have also found it really, really helpful for some of the responsive analysis that we've been doing as well. So thank you very much for putting that together.
Thanks, Harriet. That's helpful. Ted, over to you.
Thank you, Peter. I want to talk really about two broad areas. One is the development and what we're doing to build on the emergency support framework, which Kate has been talking about, but also the current regulatory activity in the Hospitals Directorate, just to bring you up to date with that. On the first of those, the emergency support framework, if I can remind the board, was introduced to enable us to monitor services at the height of the COVID pandemic. And it was a new tool, and it had essentially two aspects to it. One were a series of questions that were to test the preparedness of services to respond to the COVID pandemic. And secondly, a digital platform underneath it to collect that information, to enable it to be collated, to enable us to produce analysis of individual providers, but also across sectors. So it had two elements to it. Now, in terms of where we are at the moment, it is being rolled out, as Kate has explained, across the directorate, and is being used. And we've had some really very good feedback from our people using it, but also from providers about how it has been used. And one of the things it's enabled us to do is to provide support to providers when they needed it. For instance, sourcing PPE. We wouldn't source it for them, but we could direct them where they could get support to do that if that was a particular issue for them, and also around testing and similar things where we can provide support to providers. So it had an aspect of providing support to providers, hence its name, but it was also a monitoring tool. But it wasn't our only monitoring tool, and Kate's talked about some of the other monitoring tools she's been using. Just to remember, we've got good feedback and care. We've still been receiving whistleblowing and feedback from staff about services and their concerns. We get reports of serious incidents and investigate and follow up on those. We monitor clinical outcomes, and we've continued to do that through the whole process. And of course, we've got a lot of our intelligence is based on our previous knowledge of services. We have detailed knowledge of quality in services going backwards, and we can build on that and use that to interpret. So ESF has fed into that monitoring, and it's been useful in that regard, but all the other monitoring has been going on, and that is now driving an increasing series of responsive risk-based inspections, as Kate has outlined, which are being conducted across all three directorates. So as the pandemic as we're beyond the peak of the pandemic, we're reassessing the way forward, building on what we've learned from ESF, building on what we've learned from our other monitoring and our previous inspection methodology to say, how can we go forward with a methodology that is proportionate but is effective in identifying concerns in services. Clearly, going forward, we will be, and this comes back to what Ian was saying right at the beginning of the board, we are not back to normal. We are in a world in which COVID is endemic. There may be further peaks, but even if there aren't further peaks, there is still a risk of COVID infection. There's still a risk that our infections can become vectors of infection. And we've discussed at the board before our concern about infection outbreaks in hospitals and care homes, etc. So how can we go forward with an approach that is proportionate but effective, building on what we've learned? And I think the technology platform beneath the emergency support framework is going to be very powerful in that regard, and we are building on it, and we are developing over the next few weeks what we're calling a transitional regulatory framework, which will be a framework to take us forward into a programme of planned inspections going forward later on, which we hope we'll be launching in the early part of the autumn. So going forward, we're continuing with our responsive risk-based inspections across all directorates, and they'll be building in numbers over the next few weeks. And then as soon as we can, we'll be launching this new framework. Now, we can't be sure of the timetable of that at the moment because it depends on the progress of the COVID epidemic. If there are further peaks, we'll have to respond to that. But I'm very hopeful we'll be able to get on the ground doing regular planned inspections in the relatively near future. So those are our plans going forward for the emergency support framework and building on that to our new platform going forward. And just to talk a bit about what's going on in the Hospitals Directorate, we've been using the ESF to support our work around infection prevention and control in hospitals. And we are contacting all NHS trusts at the moment to test their compliance with infection control guidance. As I've discussed at the board before, effective infection control is a very important prerequisite to have to provide safe services and build non-COVID services going forward, which of course is the immediate priority. And we have built a second iteration of the emergency support framework, built upon the guidance from NHSE and Public Health England on infection control for hospital trusts. And we'll be testing that out over the next 2 or 3 weeks. And we'll be reporting back to the board and in our insight report what we have found in that process. But also, I hope it will be a supportive process, because some hospitals may need to be put in contact with colleagues where they've addressed these issues more effectively. And we'll be building on that support framework going forward. But in hospitals, we are now steadily building our responsive risk-based inspections, and they're based on all the intelligence I was just talking about. And we're going back to services that we have concerns about across the country, both in mental health and in acute services. And I think those inspections will build progressively over the next few weeks as we identify concerns and as people bring concerns to our attention. So I'd just say a big thank you to people who have raised concerns with us. As Kate has emphasised, it is very important for us to understand what is going on in the service and to be able to respond to it.
Thanks, Ted. Anybody want to come in, or should we move on to Rosie? Rosie, then let's come to you, please.
Thank you, Peter. And just to reiterate what Ted and Kate have said about inspections and whistleblowing, we're working very closely together across all the directorates so that we can, particularly around the returning to inspections, we are consistent in our approach. We have rolled out ESF in all of our sectors now across PMS, and that is going well. And just to reiterate Kate's point, this is a supportive tool, and it's very much looking at improved engagement and supporting providers during this very difficult time. We've had very small numbers of whistleblowers, but actually we've followed up all of those, and some of those concerns have led to responsive inspections, and we are starting to increase the number of responsive inspections that we are doing. I just firstly wanted to talk about the reopening of services in a couple of the sectors in primary medical services. Firstly, in GPs. So I think the message I'd like to get across is, firstly, they've never been closed, GP services, and actually we need to be encouraging people to contact their GP with symptoms and to access help. We need to be continuing the message around the NHS is open, because I think there is still concerns that people are reluctant to access help for the care that they need, and I think that's something that is very important. GPs did scale back in some cases on some of their routine work. That's now starting to return back to more normal levels, and we are still hearing about some problems with that, such as some of the referral pathways into secondary care and some of the difficulties that in some areas that is causing. In dentists, they've had NHS England guidance about reopening from the 8th of June, and we're working with the dental sector to look at how we can support safe care as dental providers are reopening. They're under a huge amount of challenges, the dental sector at the moment, and they've got both in terms of the capacity that they can deliver with the concerns about aerosol generating procedures. Adequate quality and quantity of PPE is causing a problem still, and the arrangements for social distancing. But we think that about a third of practices are now offering a kind of wide range of options to patients, and about 2/3 are continuing to offer advice, antibiotics and analgesia, and then being referred on to the urgent dental centres, of which there's about 550 in England. So that just to mention a couple of the sectors there. I won't go into each of the different sectors. In the report, there's a couple of areas I'd just like to highlight. The first is around what we're calling Send To. So I think this is a fantastic news that there's been discussions with Ofsted, and we have now agreed on a further programme of work with Ofsted running from 2022. we've got a great partnership with Ofsted. It's a very, very vulnerable group of people that we go out, work with to inspect to make sure that they have good care, and it is a prime example of actually how system working is so important. And our children's team have got a lot of experience of understanding how a local system works to deliver services, and actually it's broader than most of the work that happens and we talk about amongst health and social care, because this also includes education, which and how those systems work all together. So I'm really pleased that that's been commissioned again, and I think it's the children's team are absolutely great, really passionate about what they do, and I think that the fact that we've been recommissioned is a real testament to what they do and their passion and experience in delivering this programme. The second area I wanted to mention was around our local systems work. We've talked previously at the board about the importance of providers working together across the local system to be able to deliver really great care for people. And people don't often use just one service, but people with complex needs particularly often use many services across the local system. And it's absolutely vital that those providers work together to ensure the best possible care for people using their services. And we know that we had the great work that happened in 2018 around local system reviews, and there was a huge amount of learning from those local system reviews, which we've continued to talk about and share. We've noticed during the COVID period of time, we've seen some really great examples of innovation. We've seen some great examples of providers working together and really coming together to deliver, things that might have seemed impossible beforehand during the COVID period. We've also seen some areas which haven't worked quite as well, and we've seen some concerns being flagged with us about things like primary care support to care homes in a small proportion of cases. We've seen concerns about pathways between primary and secondary care and discharge pathways between hospitals and social care. And I think it's really highlighted the need for us to be thinking about how we can capture and learn from the last few months and really share that. Particularly, I think there is some urgency around this, because I think the more we can share in light of any potential second peak or any particularly the difficult winter that may be ahead of us with winter pressures is really important. So we've done a very short piece of work around some engagement calls with senior leaders to capture some information which is feeding into the Insight report that we're discussing later today. But our plan is to roll out a series of provider collaboration reviews over the next couple of months that will really capture this information. It shouldn't be it should be straightforward for the providers to be able to engage with this within a local system, but we will be able to capture that information and then share that more broadly, building on the lessons we learned from Beyond Barriers following the local system reviews. So I will stop there and happy to take any questions.
So it's not a question, but just a comment, Rosie. It does seem to me that exactly as you said, these PCRs are really important. We've always known the way that different parts of the system work together has a massive impact on people and the way they can access services, particularly people with long-term conditions. But even more, and you meant to mention winter pressures. I mean, even if miraculously COVID doesn't rear its ugly head all next winter is going to be very difficult. And the way the individual services are opened up to prepare for next winter is going to be really important, but also the way that services work together to make that happen is going to be really important. So, I just want to commend the work you're doing. I think it's really, really good. Does anybody want to? John, you want to come in?
Thank you, Rosie, for that. I've detected there's sometimes a difference in collaboration between the leadership of organisations and the reality of what actually happens and makes a difference in terms of the collaboration on the ground to patients and citizens. Is it intended in your reviews that you will be looking at a different strata?
So we're hoping to be able to pull together the data that we hold for a system, which will look at the outcome data that we can get, the intelligence that we get from local patient groups and bodies such as HealthWatch, the data that we can obtain about anything else that's going to help us to understand what a person's journey is through that local system, and combine that with the view from the system leaders as well across the system. So I'm hoping that we will be able to help systems triangulate whether there is that mismatch or whether actually it is aligned, the view of the senior leaders across the organisations and what someone experiences, because actually I think that is something we see from in some systems, is that the two sometimes don't match. So that is something we are aiming to align. These are not going to be massively in-depth reviews. We want to do this is a kind of shorter, kind of more high-level piece of work to start this discussion and to start to identify themes. And we are conscious that providers are under a huge amount of stress and pressure at the moment, and we don't want to go in and kind of create an enormous amount of work for them. So this will be fairly high level at this stage. But we want to be able to capture as much information as we can to be informative, because this is about how we can support systems to learn and make sure that they do look at quality care and safety of patients.
Thank you.
Robert, you wanted to come in.
Thank you. So rather on that theme, I was able at the Health Select Committee yesterday to raise various concerns that had come to HealthWatch, and some of them were about cancer services, but the point actually could apply, I think, to other services. But we did hear a very moving story given directly to the committee by a cancer patient. And it's about waiting lists, really, and the treatment of people on waiting lists. And the complaints that we're hearing about are, firstly, people aren't getting any explanation as to why their treatment or appointments have been postponed. There's been some inappropriate communication, such as cancer patients being told that appointment has been cancelled because it's non-urgent, which clearly doesn't go down well if you're expecting some form of care. And also there seems to be a lack of interaction between providers and, sometimes anyway, between providers and patients about their ongoing care and needs, which of course can change in the course of waiting on a waiting list and not knowing when things are happening. And I just wanted to ask, and maybe not you, Rosie, maybe one of the other inspectors, what CQC can or ought to be doing in relation to that sort of issue, which is a bit generic, but at the same time is quite specific and very important to really quite increasingly large numbers of people.
So maybe if I could start and then hand over to Ted, if that's okay with Ted. So I think the first thing to say is that we do know that there's been a significant drop in the number of 2-week wait referrals from primary care into secondary care. And I think there is a lot of work that's going on around that with NHS England and cancer teams to try and understand how much of that is related to people not accessing support and care when they actually have symptoms and being reluctant to access services, and how much of it is related to what's happening within the primary care setting and the referral pathways onwards. I think just to reiterate for any of the public who are watching this, if people do have symptoms, we do need to encourage them to go and seek help for those symptoms, because I think that's a really important message. In terms of the primary care aspects of this, we had a conversation yesterday at the Primary Care Quality Board, which is a board that I chair that has a lot of the senior leaders across primary care, and we did have a discussion about how do we start to get into the detail around this as the board, so we can understand the priority areas and understand how do we support that, how do we make sure that support for good, safe, quality care is there across these kind of areas in these difficult times. Ted, can I hand over to you?
Yes, thank you, Rosie. I think, Robert, you raised an important point. As I've said earlier on, I think getting the capacity and the infection control right in services so we can then reinstate other services is really very important. But equally, we know that a big waiting list is built up, and management of that waiting list is going to be absolutely key going forward. And this is a whole system issue. It isn't just for acute providers, but of course they will be part of the system that needs to manage this. And I think from previous experience, we've seen that there is a lot of variability in the quality of waiting list management. Some of that is around administration and making sure that it's administered properly, but a lot of it is around the care for patients. First of all, identifying the priorities on a waiting list so the people with the most urgent needs get care according to that priority. To come back to the point you were making about cancer services is very important, and not to assume, particularly when there's a delay in the waiting list, as there has been because of COVID, that everyone's needs are exactly the same, and there has to be some kind of prioritization. But equally, I'm concerned that there is a real concern that some people, some individuals may have got lost in the waiting list management process between their referral and the acute hospital or whatever. And it is very important there is a safety net to make sure that people are not lost from waiting lists. And I think in the past we've seen a waiting list where this has not been managed well, and there is a real risk to that. And I think we do need to work with providers to make sure the good practice around waiting lists is absolutely central to the recovery from the COVID epidemic, because this is going to be a long-term issue for quite a while. And we need to get it right to protect people from suffering any unnecessary delays and therefore any unnecessary harm.
Thanks, Ted. Liz.
Thanks very much, Peter and Rosie. Two questions, if I may. The first one is it's great that we've been recommissioned around the special education needs and disabilities work jointly with Ofsted. I noticed that we're asked to ensure that the inspection programme focuses on the views and experiences of children and young people, which sounds absolutely vital. I just wondered whether this is an area in which we need to further develop our methodologies and expertise, or whether that's kind of simply a continuation of how we're working anyway with Ofsted. Just a question really as to whether that's an additional priority for us. And my other question is the provider collaboration reviews, again, really positive that this is happening. And I think it's entirely understandable that we're focusing on the over 65 population group. I just wonder whether you expect there to be learning for other population groups, or indeed whether other areas of our work will be picking up some of those systemic issues for people, for example, people of working age who might have a learning disability or a long-term mental health condition, for whom there are also very significant systemic issues. Thanks.
Thanks, Liz. So with the SEND programme, with our current programme, we already do work to look at actually how we capture those views and experiences of young people. I was fortunate enough to spend a week on a SEND inspection earlier in the year before COVID, and it was really interesting watching how the team worked with young people, worked with the advocates, the advocate groups for the young people. And I have very poignant memories actually of sitting in a room full of young people, hearing their experiences, and that very much played into the overall judgment of the area. And so it is something our teams already feel is very important. Now, I'm sure that we can continue to learn and improve what we do. I think we can never get to the stage where we get enough of the user voice in what we do. And I think that this is an opportunity to build on what the teams do at the moment and continue to develop that. So it is absolutely very important for us. In terms of PCRs, our original proposal was to look at a whole variety of pathways, but actually in terms of the timescale we want to do this in, we picked on the over 65s and partly because we recognise that that is a group that often has more complex needs and actually often will require more use of services that need to work together. But as you say, there is multiple different pathways that we could be looking at and multiple different population groups. And I think what we'd like to do is learn from the work that we do to see how, as we go forward, is there an opportunity for us to refine that and to consider, for example, people with learning disabilities, urgent emergency care pathways, cancer pathways we've talked about earlier, all sorts of opportunities. So this is hopefully a starting point of something that will be something that we can continue to build on and work on. I do think, though, that there is often, I think if systems work well together and think about person-centred care and put person-centred care at the heart of what they do, then actually they should be able to get those interfaces between different providers right for every population group and not just the over 65. So I think it is about it is often about all of the things that we know about relationships and leadership, and it will be interesting to test going forward whether, if you're a system that's providing great care for over 65s, whether that does impact on your ability to deliver great care for other parts of other population groups. So I think it's a great question, and it's something that we will be interested to explore.
Harriet.
I was just going to add to that to say that with through the sort of joint network voice, we have a wealth of experience from our members with their families, from both personal and professional experiences of working with people with learning disabilities in particular, and understanding some of the kind of communication differences that might impact on user voice and things like that. And so I think it's also important to note that we do have people already who have a lot of experience of this, whether it's personal or professional, which they may be able to translate in driving this improvement forward. And I'm thinking especially of the Carers Equality Network and the Disability Equality Network in that. But again, anything we can do to help spotlight you to particular people, things like that. You know, we do have a lot of people with some very, very rich and complicated and detailed backgrounds and in this particular area. And, you know, I think it's great if we've got that wealth of resource here for people that we should let them, you know, be able to participate and shape it.
Thanks, Harriet. Liz, you've still got your hand up, but I'm assuming that's from last time, yeah? Excellent. So are we happy to move on? Okay, I think let's do that then. So Kirsty, I think it's over to you for the performance report, please.
It is, and I'm actually going to hand straight over to Chris to talk through performance, and he's going to come back to me and I'll talk through the people's side. So Chris, over to you.
Thanks, Kirsty. Yeah, so we've got a new dashboard in this year, which you can see is one pager in the pack. We'll do a quarterly update, which will have more visuals to supplement this one page dashboard, but hopefully get used to the look and feel of how we'll be reporting our performance this year. A few key areas to pull out, even though it's just the first month of the year. Just this is just reporting on April, but registration. So there's a lot of focus gone into registration and understanding. Focus on the timeliness measure, on the complexity of applications received. So what we've done here is boil this down to simple and complex applications. And the target for this year is to improve processing time for both types of applications. In April, on average, simple applications were processed in 21 days and complex in 103 days. So this will act as a baseline to monitor improvements throughout the year. Some other areas, first rating following registration that we've got in the pack. In the last 12 months, 72% of locations have been rated as good or outstanding at the first inspection against a target of 80%. And registration representations. So both of these are tracked as AMBRA currently. Registration representations, 83% representations were received in the last 12 months. 82% of the notice of proposal being adopted compared to a target of 90%. So we'll track this on a rolling 12-month basis. In terms of safeguarding, 100% of alerts were referred within 1 day in April, and 98% of safeguarding concerns had mandatory actions recorded in 5 days. Both of these have a target of 95%, so both tracking green. Report writing is another area we've been focusing on heavily. So we've mapped out each stage of our report writing process with the aim of improving each stage of this of the process, and that'll be reported and tracked throughout the year. And the last area for me to cover on is finance. So COVID has impacted quite heavily on our ability to understand our financial outturn and projections. We've currently got lower costs as a direct result of activity with where our large volume of activity haven't taken place. So things like travel and subsistence have really fallen away. However, we're really trying to work to understand what's our recovery plan for the remainder of the year and any potential loss of income we may face as a result of COVID and the impact it has on providers. On our capital programme, so this is track red there. So start the year with an adverse position. However, managing this pressure and we don't anticipate that position to continue. So hopefully we'll see an upturn as the year progresses. I think that's fair to say. So I'll pause there, but happy to take any questions.
I always like a director of finance who says, hopefully we'll see an upturn.
We will see an upturn.
Thanks, Chris. It's probably a question for Kirsty, and we may not know the answer, but for the complex registrations, we're talking about sort of 3.5 months as a target. Do we know that potential registrants approaches at the right time, so that they don't wait to the last minute and then there's a sort of long delay before they can get the service? I mean, and do we do enough to sort of publicise that as you're preparing to do something, and obviously you'll be got a long lead in before you become a complex applicant? Do we find that people engage with us at the right time, so we're not a reason for delay?
Yeah, so excuse me. So this is part of the work that we're doing, I think, around complex applications, that we've broken down the time from start to finish and looked at all the stages. And there's quite a lot of time which is actually outside of our control, in that people have sent us stuff. We've had to go back for clarification, and that piece has taken quite a long time to get the information together. So we're looking at how we can monitor our bits of that, and then how we can also try and close down the time it takes in the elapses between those bits where we're going backwards and forwards. But what we're also looking to do as part of our sort of registration transformation piece is do a bit of learning that they've sort of things like the planning inspectorate have done, where we want people to come to us before they make an application, so we can talk through them and work with them at the start of that application before they actually ever put anything in, to ensure that they're actually making an application in the right way, they've got all their information together. And then the other thing that we're doing as part of the improvement piece is we're holding applications. We're not letting them go forwards. We're not letting them go forwards until they've got everything ready, and then we can push it through at pace. So there's a whole heap of, sorry, I've got builders banging on the door. We've got a whole heap of work in this space, which I'm confident will start to concertina these timelines and make a better service for applicants as well.
Great, thanks, Kirsty. Any questions for Chris or Kirsty before we move on to the people plan?
Could I have a quick question, Peter?
Yes, Robert, please.
I thought this layout was really helpful, but just one question about number 5, representations upheld, target more than 90%. Do we mean representations upheld in the sense that looks to me as they were upholding a representation that something is incorrect, but am I getting the communication the wrong way around? Do you see what I mean?
Yeah, it's where we've made someone's put a representation into us, and we have been successful in defending it, I think is what it actually means. So,
that's the wrong. The word is wrong, if I may say so. It's not, you're not upholding representation; you're dismissing it. But
dismissing it, yeah, that's what it
you're
is.
You're wrong 90%, 82% of the time, which would be disturbing.
No, it's the other way around. So it's just correct that one.
Thanks, Robert. Mark, you wanted to come in. Mark Saxton.
Yeah, thanks, Chairman. Chris, thanks very much for this new format. It's really good. Just the people turnover one, as we've discussed before, and we have shared at the board before, not only our global employee turnover number, but also our number of, or our percentage of turnover with less than 2 years service. And I'm hoping that this format will allow us still to have access to that data on a quarterly basis, I think we said.
Yeah, I think that will be in the supplementary pack I referred to, but I will double check that is in there. It should be, but you should see that on the quarterly basis.
Thank you.
Okay, good. Let's move on. Kirsty, it's still with you in the people.
Yeah, so we'll talk through the people plan now. So as I think we've mentioned on a number of occasions now, we've taken a sort of holistic program to looking at how we work to ensure that CQC is and remains a place where people are proud to work for. And as part of that, we've got a number of initiatives that we're running to ensure we move forward in the right way. We're putting them into an overall program to make sure that we can keep visibility over them. And what I thought I'd do just today is just to highlight a number of key aspects that we're working on at the moment. I think a key one, and a very timely one actually, is the launch of our diversity and inclusion strategy. We launched that on the 4th of June. Unfortunately, this was a victim of COVID. We had a big launch event planned for March, and it got delayed. So we decided to take this forward. This is our 3-year strategy, setting out how we are going to become a truly inclusive organisation where everyone can be the best version of themselves that they want to be. We are quite ambitious in our objectives here. We've set it around 4 key themes: how we make an inclusive culture, how we have inclusive engagement, inclusive leadership and accountability, and also inclusion policies and practice. So over the next month, we've got a number of events happening where we're bringing people in to talk about their experiences and to sort of set out good examples of what good looks like in this space. And I'm really delighted we've got to this point of being able to publish our strategy. It's a very important document for us and sets out our ambition in this area to be world class, I think, in this space. So following on from that as well, obviously, as Ian alluded to in his earlier reports, we've been working with colleagues across the organisation who have been quite upset and disturbed by some of the images that have come across in result of the disturbing events in America around George Floyd, and also the publication of the PHE report on the disproportionate impact on BAME colleagues from COVID. What we've done in response to that is held a series of listening events. The first one was last week, and we've got another one tomorrow, where we're really exploring people's concerns with a really a real desire to listen and understand rather than to solutionize. And those have been well attended and have been very successful. We're also doing some work to look at, as we're starting to be more active now, crossing the threshold and conducting regulatory activity, a risk assessment for our BAME colleagues to ensure that we are able to keep them safe and as we start to go out, and making sure that things like PPE are properly available and people are well trained to use it. Our work on cultural inquiry continues, and this is a key strand of our transformation agenda. We have launched a number of workshops to really start to explore and observe key aspects of our ways of working and our organisational behaviours. These have gone down really well. In fact, they were a sellout pretty much when we launched them, and have been well oversubscribed as people are keen to get involved in the sort of participatory nature of these workshops. And we're going to run a few more so it can really start to give people an opportunity to explore our culture in a bit more. to help us inform our transforming programme going forwards. We have an ongoing set of work around reviewing our policies. We have reviewed a number. These are ongoing so that we can completely review all our policies over the next year or so to make sure they're completely up to date and are suitable for a modern organisation moving forwards, and that continues at pace. We have our pulse survey a little later on in the agenda. This is the first one of 2020. We had it open during the 15th to the 29th of May. We're really pleased with the results that we've seen. What we're planning to do is keep these going on a frequent basis over the year to really just give us an opportunity to test the temperature of the organisation and get some feedback in terms of what's working well and what's not so working well. And this is particularly important as we start to move through our transformation programme and the work to do around transforming our organisation, as it's vital we continue to engage with colleagues in a positive way and ensure that their voices are heard during this period. Our learning and development team have been particularly active during this period of time. They've done a huge amount of work to move what had been normally face-to-face training onto online training to really support our response to COVID. And in particular, they have pulled together at relatively short notice some very good training on infection control and use of PPE to support our colleagues who are going back out onto the front line. So overall, I think there's a lot of work happening in our people space. We've managed to cope well with the impacts on COVID as people have been have been very busy, so both supporting people going on secondments, looking at our risk assessments, looking at how we ensure our workforce can continue to work well from a home-based environment when they've normally been in offices. So overall, I think I'm pleased with the general direction and progress that we're making in our people space.
Thanks, Kirsty. I too am encouraged. Liz.
Thanks very much, Kirsty. Very good to see the launch of the diversity and inclusion strategy, and I think it's a strong document. We know from evidence on inclusion and diversity that one of the things that makes a real difference is how far the learning and accountability for actual progress, how well that is happening in all parts of the organisation, from the teams to the management to the executive and to the board. And I just wondered if you could say something on the plans for how we as a board will get to hear how things are going, because we also, there's huge amounts of energy behind this work, I think. But what we want to know is progress being made, and do we need to fine tune any of the things that we're doing to ensure that it really does bring the sort of shift that we're after?
Kirsty.
So I was just trying to unmute. It was catching up. I was being impatient, pressing it too many times. Liz, yes, thank you for that. What we if the diversity and inclusion strategy has as our action plan attached to it, and we intend to report against that on a quarterly basis so that we can see the progress. The progress that we're making and ensure that we are doing the things that we want to do. I think some of those things are going to take a longer time frame to fix, and they're not a quick. There's not a quick fix to them, or to be honest, we'd have already done it. So I think we want to keep this reporting coming. I think the other thing we want to do is, as well as sort of using the information that we're gleaning through staff surveys, and maybe that's an area we want to explore through our pulse surveys as well. So we will keep you posted formally quarterly, but I think as other things, as we start to bring other things forward, I think it'd be useful to have a regular sort of conversation about this at the board. And I know the networks will come on us a quarterly basis, I think, anyway, to talk about what they're doing, and I can promise you they do keep us in good order if we're not progressing at the pace they need to see.
So, Harriet, does that cover what you were about to say, or do you
pretty much, actually? I was just to say that we've been involved in the diversity and inclusion since Safina, our excellent lead, took it over. We were all really disappointed because it was an amazing launch that was planned that unfortunately did, as Kirsty say, fall foul of the COVID situation. But we've been involved every step of the way to make sure that diverse voices are represented in the inclusion strategy and that it can be properly embedded within CQC, because lots of the kind of concerns that we have raised from the staff equality networks is about that inconsistency of where some people are doing an amazing job and some people, sometimes struggle to get it right. And having a particular strategy that's actually embedded and is going from the ground up, we're hoping is going to be a really good framework, if nothing else, to actually help people in having the confidence and competence to support people. And as a quality network, the Staff Equality Networks, we're going to be supporting this throughout its from its sort of beginning to the development and various things as it is ongoing. And as Kirsty said, I think a lot of this will take time to embed, because it is a slight change in culture for some people, but we're going to be supporting and speaking up about the progress that's being made from our sort of lovely position as being in tune with lots of the staff, to make sure that actually it's represented, and we will keep talking about it and make sure that it's continued to be discussed as part of our networks as well.
Thanks, Harriet. Mark.
Thanks, Chairman. Just building on what Harriet said, I think we all recognise the value we derive from all the networks in CQC. Just back to the people piece, Kirsty, really good report, and it's super to get this detail at the board. Just want to say that we also review people risks and metrics at the ACGC, and culture we've reviewed in the ACGC subcommittee, and that's an ongoing process that the committees are undertaking.
Great. Really, really important aspect of all the activity that's taking place. So thanks for the update, Kirsty, and thanks to everybody that's been involved. I think, Mark Sutton, you have something to update us on?
I don't believe so.
Oh, right. I apologise. I thought you were going to talk about cybersecurity risk.
No, there's thankfully there's nothing to report this month. Thanks, Peter.
Perfect. That's the best sort of report on cybersecurity risk. Thank you.
Yes.
Lovely. Thank you very much. Ian, did you want to say anything on strategy, or is there nothing to report to the board?
Other than strategies ongoing, and then I want to just briefly hand over to Chris just to pick up the other points.
Okay. Thank you, Chris.
Just in terms of parliamentary activity, we've given 5 different pieces of evidence over the last month to Parliament in different areas. So we've had some individual conversation with MPs in the Health Select Committee on CQC's response to COVID, but also the wider system response to COVID. We've given submitted evidence to the Health and Social Care Committee on delivering during and beyond the pandemic. And as I think was previously mentioned, we've also given some insight into the Joint Committee on Human Rights. Both Kevin and Kate gave some evidence on our response, particularly with that looking at the lens of human rights around the response to COVID. The Public Services Committee were talking about lessons learned from COVID. And there's an additional piece of work we're doing with the Health and Social Care Committee on adult social care funding and the long-term proposition for funding in adult social care. I think this reflects the broader increase in demand from Parliament on what we know, which we think is obviously a good thing, and we'll continue to respond to those challenges. I think they'll set out not just what we know through state of care, but also how we respond to these committees moving forward. Just in terms of publications, we're going to talk about the COVID Insight Report later, but the number of other publications which are coming up, which will also help shape what we know in across health and care. There's a controlled drugs annual report, which will look at trends in medical assessment, medical errors, which will feed into state of care. We're really delighted to have the third report of the Defence Medical Services. And lastly, I just want to talk a bit about give feedback on care and the public launch. We're going to have the HealthWatch report next, but this is where we've been working I hope, Imelda would say, really closely with HealthWatch and other colleagues to have a launch of Give Feedback on Care. We've talked about the technical developments around Give Feedback on Care and making it easier to use. And I think the two key challenges here, how we support and encourage more people in England to feedback their care on health and social care services, and also how we normalise the idea of giving feedback, so that it isn't seen as abnormal to offer and give feedback, but it's seen as an integral part of how services and systems and organisations like ours and like others learn and improve. So there's a number of pieces of work that are ongoing at the moment. There's a few surveys that will look to elicit people's views about how people are managing during this time, and we aim to launch the campaign formally on the week commencing the 6th of July. And so I'll talk a bit more about the COVID Insight report later. Thank you.
Thanks, Chris. Anybody have anything else to raise on the executive team report, or? Let's move on then. So Imelda has joined us. Imelda, you're extremely welcome. Robert, I don't know if you want to say anything by way of introduction to the HealthWatch report.
Very briefly, I'm certainly not going to steal Imelda's thunder. You've all seen her report, and I would like to suggest that it shows over a year an amazing amount of progress in the development of not only HealthWatch England, but also its relationship with the local HealthWatch network. And also in its ability, HealthWatch's ability to project the messages from local level to system and national level. So that was the first point I'd make. And the second is, I think it's reflected in this report, but probably not being blown with the trumpet it should be. The amazing way in which Imelda and her team have converted their organisation from completely office-based, really, to home working, and continued, as it were, without a blink, really, but at the same time adjusting to the demands of the pandemic in terms of the work that HealthWatch England and leading the network in relation to what it should be doing or can be doing in these difficult times. And she will talk to you about that. But just a word, if I might, about the future. We as a committee, as you might imagine, have been looking at our strategy. And when I say our strategy, we're distinguished by having a committee, almost all of whom were not present when the current strategy was actually set. While there's nothing wrong with it, we have decided that we should look at it again this year, not to rejig the strategy, but just to see how it's working in the current environment. And part of that, I think, will be the work we're doing on enhancing our relationship with the Department of Health and Social Services, social care. And I should say there have been some really positive developments in that field in terms of how we can work more closely with and be useful to the department. We're working through how we can better support systems in the systems which are slowly developing, which is a challenge because Local Health Watch is designed around a relationship with a local authority and not with a system, which sort of brings me to the last point, which is that all this work has been and continues to be done locally on a reducing resource. And one of the things we were working on is we have to work on the transparency of the way in which money is transmitted from the Department of Health to Local Health Watch, because frankly, quite a lot of money seems to be falling down the back of the sofa, and we need to get to the bottom of that. But even if it wasn't, the demands on the system, both nationally and locally, are such, and the work is increasing. And I think its importance is more increasingly recognised. I'm not sure we can continue to go on the path of continuous improvement unless we get generally a better resource. So that's a bid for the future. But in the meantime, I'll hand over to Imelda just with lavish praise from me to her and her team for what she's able to do.
Thank you, Robert. I don't really have a lot to say. You've got quite a lengthy report from me, and I'm sorry it's so long. It was sort of repurposed, but also we should always report back to you at this point in the year on what we did in the last year, so you get a bit of a snapshot of that, and then you get a look at what we've done in this first quarter of this financial year. I suppose what I'd just like to focus on is I think that over the last year or so, our our processes and influence has really changed completely. We are able to get the insight from what the public are telling us much more quickly into usable formats, and so to be able to influence policy much better. And so we're much more useful to all different parts of the system, which is exactly what we want to be. We want to be useful and in a timely way. But there's still a long way to go on how we gather and use data. And that's one of our focuses for this year, and will be part of the conversation we have about strategy for the coming years as well. I'd say over the last year as well is that our relationship with the network has been transformed. We've gone from being a sort of an organisation that sort of serviced it all to much more of a partnership. We've put in lots of tools to really help them do the very best job they can. So we've put in things like quality frameworks, we've put in impact tools, we've put in tools around how to carry out research, so that we try to make their job as easy as possible. And the other thing we focused on in the last year, which was quite a change from previously, was the amount and quality of advice that we gave to the public. We had very low amounts of advice that we gave to the public, but now HealthWatch England has one of its main strands of work is getting high quality advice to the public based on the inquiries that local HealthWatch get from the public about what they need to access. And it will be things like how to register for a GP, how to find a dentist, all those sorts of things are what the public ask us to do. So that's a sort of quick look back at last year. And now for the first quarter of this year, but like everybody else, we immediately turned our attention to how we could be most useful during the COVID pandemic and how we could use our resources to really try to support people to do a good job and to make sure that the public information was being fed back in. So we immediately took three priorities. One was information to the public, using government data, government information sources to get information to the public in a very digestible way very quickly. Our second priority has been to support the network, and some of that's about the huge amount of advice and guidance that was coming out on a daily basis. Some of that was about digesting that and getting it back to them in a usable form so that they could then inform the public or inform their local systems on things like do not resuscitate, shielding, all those things that were coming rapidly at us. Quite a lot of inquiries around PPE and personal assistance and PPE and people going into people's homes. The third priority for us during this COVID time has been to help people have their say. So make sure that we don't cut off that bit of feedback that we want to get from the public so that we can feed that back into the system to help the system improve. And so we've done that on specific things, like some of the things we've done is that we heard quite a lot from deaf people about the materials not being suitable for them. So then the Department of Health and Social Care did some work on that. And there's quite a few things like that we'd get quick bits of feedback and then we'd get it back out to into the system, and then new information would come back. We've done quite a lot of policy input as well in this quarter, as you'd expect us to do. We've done quite a lot of work on the NHS tracing app, on patient transport, on shielding, on the do not resuscitate, and many other areas of policy that are being developed during that time. One of the things that we're really tackling with, and this is Robert referred to it, but it's an issue that that's going to really stymie us if we don't come up with a solution. The NHS has moved itself into STPs, which are on a much bigger geographical footprint. As Robert said, we're on a local authority footprint. So in some places that's not a big deal. Places like Norfolk and Devon, that's okay. But it really matters where you've got, let's say, for example, Cumbria in the northeast, where there are 19 HealthWatch in that patch. So how you get proper influence and representation at all the different layers in those decision making is very difficult. It's a very difficult challenge. The other challenge that we're really facing is that CCGs with their merger are also now covering much bigger footprints. So where there would be a CCG for one HealthWatch, there now will be one CCG and 6 or 7 HealthWatch. So the the influence is getting dispersed. Then on the other hand, we've got primary care networks, which are very neighbourhood based and need a different type of resourcing and a different type of focus. So it's a big challenge for us and for the network at a time when resources continue to dwindle. What I would say, and my honest observation, is that the reputation of the network has greatly improved in recent years. Their usefulness to the system has greatly improved. And so although the funding is being reduced, but at a much slower rate, it was down 2% in the last financial year compared with 17% 2 years ago. And many local authorities tell us it's not that they don't value the work, they simply don't have the resources to prioritise the work of HealthWatch. So there are big challenges ahead for us. And as Robert said, we will be going back and reviewing our strategy. It's right, we're 2.5 years into our strategy, so time to take a fresh look at it. And during that time, we'll be definitely reviewing the whole issue about the way we gather data and the way we use data to make sure that it's deals with our focus that we've got on equalities and inequalities. And also, where do we, with our limited resources for us and the network, where do we really put our efforts to have maximum impact? And then my final thing, just to pick up on Chris's point, we've had a great experience of working with CQC on the campaign to get the people's views in, and we're really looking forward to that campaign being launched and to see whether when we band together we can actually have much greater impact. Thank you.
Imelda, thank you. No need to apologise for the length of the report. I thought it was a really, really interesting read, and I'm sure colleagues did as well. So thank you very much for that.
And terrible noise in the background. It's like a drill going off behind me. I don't know whether you can hear it.
At times, yes.
Sorry.
Yeah, no, it's not your fault. And I was just going to say, Imelda, that I think these changing geographic boundaries and the way that different parts are collaborating is a really big challenge for providers, for local authorities, CCTs, for CQC and for you. And I think we're just all going to have to learn how to operate in a complex structure that is not going to be uniform around the country anytime soon, and it's a challenge I think we all recognise. Mark wants to come in, and then I'm going to move us on, unless it's really important, Harriet, because we're running a little bit behind schedule. But if it is important, obviously, please come in. Mark.
Thanks, Chairman. Imelda, thanks very much for a great report again. Super to read again about your work in oral care, maternity and mental health, patient transport, which was a super report from last year. Congratulations on staff flexibility during COVID. Just wanted to ask a question about engagement. You've obviously been very successful in developing your digital platform with your website views increasing by 50%. But a lot of your work is engagement with people, with your public meetings, your annual conference, your learning programs. So just wondering if you are planning to digitize that more and to build on your learnings in this area.
Thank you. We immediately moved all our support to the network online, which previously had been face-to-face. And it's early days still, but I think it's more successful online than it was face-to-face. We're holding all our regional network meetings online, much better attendance, interesting engagement with people on it. Our training, we've put on a lot of events that we would take much longer to do, like for governors. So for the chairs and board members or local HealthWatch, they've been sold out. We move them online, they're sold out, and we've been able to get them much better cross-fertilisation. So rather than you being in the northeast or the southeast, we've got Cornwall talking to Cumbria, and probably they've got more in common than Newcastle and Cumbria. So that side of it has gone really well. We are this year going to move our entire conference online. and we're expecting to have somewhere between 600 and 700 people attend it, and we're going to spread that over a week. So I think there's a lot that has been learnt over this time that we will continue to do. The thing that we're doing quite a deep investigation in is, who does this leave behind? Who does it leave behind when we move on to more digital work, and how do we make sure people are not left behind? The difficulty for a lot of the engagement work with particularly hard to reach groups is that digital doesn't always work. So we need to get back to some face-to-face work when it's right. And we're looking at, with the network, on developing different methodologies for different types of engagement that work at different times, that, you know, that take into account social distancing. So that's a work in progress. But and some people have been doing, some local HealthWatch have been doing Zoom engagements, and they've been going quite well. Or they've been doing like support groups for their people who are really active in their network. So yeah, it's worked really well so far, but we're really very conscious that people will be left behind in this.
Thank you, Elder. I think that who are you leaving behind? I think that's a really interesting question. I look forward to hearing more about that in the future.
Thank you.
So if I could invite anybody else who wanted to comment to do so offline directly with you, Imelda, I'm sure you'd be very happy to receive any information from anybody. But I would just like to thank you and your team for all you do. I was really impressed with the report, and I know that it's very valuable both for us as an organisation, but also for the people that use services that you're speaking on behalf of. So fantastic. Thank you.
Peter, could I just say a big thank you to the support that we've received from CQC during this time. The work that happened to get the IT upgraded has transformed us all, and the infrastructure support we're getting is just great. When we really could move online in a day with no hiccups. So a big thank you to everybody for all that infrastructure support. I really appreciate it.
Great. Well, the people who gave you that support know who they are, so they will, I'm sure, be very pleased to have heard that. Great. Sorry to sort of rush on, but I'm just slightly conscious of time. Thanks very much indeed, Imelda, and obviously Robert as well. Chris, I think we move to you now for the Insight report, please.
Thank you. So this is the second Insight report we've published during this time. I think the key themes for the second edition, three things perhaps: transparency in what we know, transparency in what others know. To help, the second theme, which is improve and drive learning. What we know is from the data we've gathered and the conversations we've had, the most important thing we can do at this time is learn what is working well and what isn't. And that brings into our third theme, which is about collaboration between services, between organisations locally and nationally. And we think essential collaboration is essential if we are to respond well to the pandemic. We have seen, and we continue to see, health and care staff demonstrating enormous resilience as they face unprecedented pressure and adapting very quickly to work in different ways to help keep people safe. But as we move through this initial peak, CQC has an important role in working with others to bring together the insight about what we know and the pressures so that local systems can change and improve. This month's report focuses on some of that closer working between hospitals, primary care and social care and community services, and how that has worked well, and how organisations have used that collaboration to drive improvements in services, and which with thanks to colleagues from across CQC who've helped pull that information together from the conversations that they've had as part of their regulatory activity. There are also some good examples of case studies, and one of the bits of feedback from providers and from others.
Chris, I can still hear you. I can hear you.
Okay, sorry, everything's gone completely black, but if you can hear me, that's fine. One of the bits of feedback from providers and from others was making sure we had good examples of what good looked like. There's some really good case studies in there about what people have done to support that work well. Lastly, we wanted to provide an update on some of the latest data we hold on the impact of COVID on different groups of people, and I think that's important for transparency, and it's also important that it will raise important questions that we can collectively answer. I think the important thing about this report is it's important to get the data out to prompt the question, as well as always to have the answers. And finally, I just want to reiterate that point about collaboration between services. It is vital that we see improvements in the way services operate together. All of the good case studies and all of the feedback we've had around how services have collaborated have led to the changes and improvements that we've seen. We recently published 300 examples of how services have improved. A lot of those are about the way in which they collaborate to give people a seamless service. As ever, we'll take feedback from this report and use that together with what we know from our own regulations to guide future editions. But I'm happy to take questions.
John.
Thank you, Chris. An excellent report, as was the last one. You're absolutely right to emphasize transparency, because out of transparency comes trust, and trust is important for compliance with anything that comes through. Also, as we know, as we're going forward, infection control will continue to be crucial in care homes and in home care providers. And the availability of PPE, although that's sort of gone below the headlines now, continues to be a really important thing of that. And I was really pleased to see the data that we have that you've put in there for us to keep track on that, because infection control is important for the safety of people who are receiving home care. Who owns the data on the availability of PPE in care homes? And do you know if they're going to be as transparent about it?
So you rightly point out, we've produced, so our tracker, which colleagues in the digital team have put together, looks at domiciliary care exclusively. The NHS tracker looks at information in care homes, and obviously we'd like to make sure that we can get all of the information together, because I think with all of the information we have a better chance of understanding what we can do differently. So we're in good conversations with colleagues from NHS England, so we can present that information as a total reflection of what we collectively know about health and care. Does that answer your question?
It gives me an insight into the answer to the question.
Liz.
Thanks very much. It's a really interesting report. Firstly, on collaboration, it's great to see some examples where it seems that, in a crisis, all of a sudden people can get together and sort things out more than they've managed to do in, I can't remember the exact quote, but, in years of previous meetings and so on. I suppose just a point really that there is, as well as all the challenges of COVID, there are some very powerful examples in here of innovation that can be built on, that I think we can build on, both in terms of our independent voice, but also in future in terms of what we're looking for in our regulatory role potentially. The second point I just wanted to make was that in a couple of places in this report we see that the data that we have is not as great as it might be. For example, primary care, how consultations are recorded if they're not the traditional types of consultation, if they're online or whatever, and also the experience of people using services and how ethnicity is or is not recorded. And I just wondered if there's anything we can do drawing on this to influence the collection of better data.
I think one of the Kirsty mentioned a bit early on in terms of some work that's ongoing in this space, but I think one of the things that we've learned through this process is a lot of the data that we gathered was deliberately designed for our regulatory purposes of inspecting individual organisations and individual locations. And I think one of the things that colleagues across the organisation want to do more with as a result of this, and our own learning here, is that we should and we need to make sure we can gather what we know to publish information on behalf of the system, not just in the act of the regulation of individual locations and individual organisations. So there's some really good work that's going on at the moment to, first of all, to look at how we digitise some of these services, because they still rely a lot on on paper in a way that absolutely should not be the case, but then how we use that information so we have a really good understanding, not just of individual locations and how they are individually responding, but across local areas and across local systems.
Ted.
Yes, thank you. Well, I just congratulate Chris and his team on the work putting together this report. People have already stressed the importance of transparency, and this is our contribution to transparency. And I think we've learned, one of the things we've learned during COVID is the importance of transparency in building trust, but also ensuring that we deal with the problems as they arise, rather than, if you like, try and put them to one side. But the other thing that's important in this report, which I think is really, really important going forward, is that we and everyone else involved in health and social care adopts a learning attitude to COVID-19, accepting the fact that, you know, some things went well, some things went less well. That's inevitable under the pressure that everyone's been working. But actually, the way to take this forward is for us to all learn, so that when we're faced with similar challenges in the future, be it from COVID or something else, we're better prepared. And I think there's a great opportunity to learning coming out of these reports.
Thanks, Ted. I agree. Great, Chris. Thank you. I think I think you've heard from the board that we really value receiving these reports, and look forward to the next one. With apologies to Jill, who's joined us, shall we just take a 5-minute break, just to sort of stretch legs, and then start again if we could at 12:40. And Kirsty, do you want to say something by way of introduction, and then hand over to Jill? And Jill, I should have just said how very welcome you are at the board. Kirsty.
Yeah, thank you, Peter. So just following on from what I said in our executive update, I think this is a really good set of results. It's part of a series that we want to run over the next 12 months to give us a sense check of how the organisation is doing, and take its temperature on a regular basis. I'll let Jill talk through the detail, but personally, I'm really delighted with these results. I hope we can sustain them into the future. I think we're in an unusual set of circumstances at the moment, but I think this is a really sound set of results, and reflects very well on the executive team, but particularly Ian as well, I think, during this time. So, Jill, do you want to take us through the detail?
Yeah, thank you, Kirsty. And I would sort of say thank you for having the opportunity to sort of share these with you so quickly after we've received them. So they are almost hot off the press, in that we actually only got them sort of last week from our survey provider. So the turnaround has been quite speedy, but it felt important to come and share them with you. So as Kirsty says, this is our first pulse survey of the year. Our plan is to survey regularly, probably on a quarterly basis, because I think this gives us a much richer and more regular picture of how people are feeling and how connected they feel to the organisation, its leadership, its purpose, the things that we're doing, and the way in which people experience their day-to-day life in CQC. You'll remember that in February I brought to public board the results of our full survey that we'd undertaken in the autumn. It's fair to say that we were quite disappointed about that set of results, and particularly it led us to conclude that there were 3 key priority areas that, as an organisation and as a senior team, we really needed to pay attention to and focus our energy and attention on. So those were the sort of the perception that was clearly articulated in the feedback, that there wasn't the positive connection or direction and leadership that we'd expect and want people to have from our executive team and the wider executive colleagues. How we managed change was not being received in a very positive way, and we weren't doing as much as we possibly could to communicate effectively with our teams and with our colleagues across the organisation. So that was quite sort of a stark set of results, and we've taken those points really seriously. So this Pulse survey in May was our first opportunity to test those themes and to see how we're doing against what we'd actually articulated both to the board, but also more importantly to the wider organisation, that were the things we really wanted to pay attention to. As well as, I think, taking the opportunity of testing against a specific set of questions on COVID-related matters, particularly focusing on the well-being of our colleagues and the support that they were getting from their line manager and the organisation as a whole. So I shared a very brief summary paper with you. I think the headlines that bear repeating at this stage is, as Kirsty said, this is a really positive set of results for us. It's data that is very positive, and more positive than even I was expecting it to be. And I have a kind of optimism bias within my soul. We have seen significant shifts, statistically significant shifts. They're not just 1 or 2 percentage points. They are big shifts in all of the 6 questions that we can directly track back to the full survey in the autumn. I'm particularly wanting to draw attention to the shift in the question about visibility and direction and leadership from the executive team. Kirsty alluded to it. The fact that has gone up by 41 percentage points to a positive total of 75%, I think is a really important point to note for us in this discussion. And while Kirsty has sort of said it, I think it does worth bearing. So much of this in what we hear anecdotally in some of the commentary from the free text comments within the survey is to do with the really clear and direct focus and leadership that Ian has demonstrated throughout the last several months. I just wanted to get that on record. These results also show us that people are feeling much more positive about change and how we manage change, and much more positive about how we are communicating with them regularly and keeping people up to speed. And I dipped in right at the end of Chris's bit. This is an important part of actually what we're doing in terms of making sure that our colleagues are as connected as the external world is, as our external stakeholders are, and they feel completely up to speed. There's also, we've been able to gather some really, really important data about our colleagues and their well-being, and also the support that they're finding and getting from the organisation and their line managers during COVID. There is some real honesty in the commentary around the reasons why people are responding into the question, which is, how have you been feeling for the last week? And it's fair to say there's a mixture and a spread. So while 42% of colleagues were feeling good, that the 38% of our colleagues were saying they kind of felt average. And 22% were saying, I'm not so great, I haven't been quite so great. And the reasons that sit behind those are very interesting. And actually the comments that sit behind them are really honest. So I noticed, compared with the commentary from the autumn, a shift in tone. So where people are saying, I don't feel so great, this is in the context of actually, some of that is to do with the fact that is outside the organisation. It's stuff that I'm worried about my family, my own health, vulnerabilities. It's relationships that may or may not be being as helpful as they might be. And as well as, actually, it's fair to say, some colleagues struggling to feel that they're actually kind of making a difference in their day job. So, there's stuff for us as an organisation to focus on, but there's also some really important things that our colleagues have felt able and honest and trusting enough to tell us. And I think that, for me, shows a real shift in this data. So just before we kind of open up for a discussion, I just wanted to sort of just give you a heads up as to what we're doing next. We're sharing the results at a more local level right now. That will start some conversations locally about the sort of different areas, different directorates, different teams, results and what that means. So far, our discussions in the senior setting have been very much around how we can sustain this going forward? So how can we make sure that we capitalise this and we don't lose this sense of positivity and momentum? So how do we build in the aspects that have contributed to getting us to this set of results and where we are now into our lessons learned about COVID, into our recovery work, and into so that it becomes the normal way of working. It becomes our habits in the organisation as leaders, so that we can continue to sort of see results like this going forward. And that will be a challenge for us, because we know that we've come together in a crisis and have dealt with that. And actually, it's unpicking the things that have really made a difference and really worked, so that we can really actually consciously build those in. Our colleagues have told us, one final thing from me, that actually the things that have made a difference for them have been how we've really maximised and utilised our technology to help them feel connected and informed. So the virtual conversations we've been having through the platforms that we've got in place in our sort of technology suite, the very clear connection that they've had to Ian and the executive team and the wider leadership group. That visibility and access has been really important, and we need to make sure we don't lose that. And also their ability to be involved in and have sight of the changes that we've been making. So that must be, and the decisions that we've been making. So that is obviously to do with the way in which we have brought people into the change and decision making around the ESF. So it's positive. There's still lots to do, and I'm really keen to have comments or reflections or questions.
Thanks, Jill. And I should have said that Paul Sumner and Kieran Prasher have joined us, so they may answer any difficult questions that you want to deflect in their direction, Jill, I suspect.
Absolutely.
Harriet, you want to come in?
Yeah, just to comment on it, that it's, congratulations again, Ian. I know people have already said it, but I think the visibility has made a real difference to people, and your sessions, I'm going to call them, have been very, very clear, and it's made it very, very easy for people to be consistent in their approach. And I know, from the so-called anecdata that we've had back through the networks, that's been very much appreciated. One of the other things that was interesting coming out of the free text comments from the report, Jill, was the mention of flexibility, and how that has, the free text comments I think can sometimes explain the figures a little bit, and flexibility is definitely one of those things that I think CQC has done really, really well in terms of flexible working throughout this period, with the technology and with the flexibility to be flexible, basically. However, I know that there is some, perhaps not concern, but just some discussion both within CQC and in the wider world, that as far as that's concerned, we don't want to go back to business as usual. And as you said, I think keeping those ways of flexible working will be a really good option for helping people to kind of feel like they're still engaged and they have these control over things, because that's been a really, really positive impact of everybody suddenly having to work at home and juggling various kind of caring responsibilities and things like that. And it would be really, really, really good to see that continue, so that we can continue to support our colleagues to work flexibly wherever possible, basically.
Thanks, Harriet. Ian.
Thanks, Peter. Thank you for the kind remarks from various people. I think it would be fair to say, though, that whilst I have fronted a number of the all hands calls and so forth that we have each week, which are symbolic of a lot of this stuff, I think the work that we've done as a collective behind the scenes has been really important. And I think my reflection is that there's something about a pace, a tact time, to use the lean expression, but a cycle time of decision making, which has been much faster of necessity. But it also, even the fairly prosaic decisions that we've made, we've been able to pick up a concern and deal with it. A simple example recently was the small allowance we put in place around people who've been unexpectedly working from home. That was something which we initially took a view on. We listened to feedback from trades union colleagues, from colleagues in networks, and frankly from the wider group. We got a sense of where people were coming from. We were able to then review that decision really quickly, make a different decision, and then put something in place. And again, that's that ability to make decisions at pace, get some feedback, and in some cases overtly change our minds on topics, and be quite blatant about that, and say, this is where we stand at the moment, and we'll look at it again sometime in a few weeks, and then be able to do that, and then be able to sell it into the leadership groups. I think that for me is a real point of reflection here, is that ability to flex and change and do things at pace is as much a feature of this result, I think, as the way in which it was communicated. So I think that back office bit is something we need to reflect on. Thanks, Peter.
Thank you. Mark Saxton.
Thank you, Chairman. And Jill, thanks very much for a very good report, and super to see results so positive around the executive team visibility, health and well-being, and recommending CQC as an employer. You asked a question about what worked. And I thought perhaps something that did work that's not really reflected here was how during this period and during Ian's comm sessions, we actually listened to colleagues. So we had some really interesting presentations on volunteering, on working during Ramadan, on COVID inspections, and on ESF and others. And I just wonder whether, there's not something there that we could capture and build it into some sort of induction tool, so that people can, hear employees' experiences in the jobs that they're coming in to do.
So, Chris, Usher.
Thanks. My point was kind of building on what Ian was saying, really. I think this has given us an opportunity to have a full feedback loop that we haven't really seen before. So you've got a direct access to Ian, and you can see his message, or other members of SLT, but equally then we're following up, Chris's team are following up with a regular beat of comms, where it would be hard for anyone to say they have missed a message. There's a beat there. But then that also allows people to directly raise questions on the call with Ian or others, and you can see the questions come in, and the questions will either directly be answered or taken away, and Ian will pull out themes of questions there. So people have got an access to kind of digest the information they've got, but then also raise questions on it. And as Ian said, some of those have led to, actually, we might need to look at this, we might need to change what we do, and people can see that. I would hope people can see that. So there's this kind of 360 loop that we haven't seen before, which I think is a real positive.
Really good point. John.
Thank you. I can only add to the congratulations to all the ET. My take on this is that virtual visibility trumps no visibility, that verbal communication trumps written communication, and feeling involved in trumps just being informed of. And if you take those principles into the next stage of transformation program, it will soar. So I hope that you can do that and keep at it. It's been a wonderful thing to see.
So no room for complacency. Let's just make that clear. But really, let's also celebrate a dramatic improvement on the survey last November or whenever it was. So I think real congratulations to all the executive team for achieving this turnaround, which is great. So Jill, we'll see you in 3 months' time with the next Pulse survey, no doubt, but we may see you before then on other things. But thank you very much indeed. So
thank you.
Can we move on then to the Freedom to Speak Up report? And I want to welcome Carolyn and Julie, who have joined us. So I don't know which of you is going to start, but can I hand over to you two, please? Whoever is going to start is probably on mute, because Carolyn, are you going first?
It's Carolyn, yeah.
Right, over to you, Carolyn.
I'm Julie. I don't know where Carolyn is.
Okay. Well, Julie, in that case, well, would you like to start? You're going to give us a report.
I wasn't meant to, but
right.
I can do. Yeah, thanks very much.
Okay, I was expecting one of you to give us a report.
Yeah, absolutely. Carolyn has prepared something, and I was here as a supporting role. She says, I can't seem to get you to hear me. Oh,
I was going to say, she's certainly in the meeting.
She is in the meeting. Yeah. Okay. Well, thank you for inviting us anyway, and I will. I'm going to wing it.
Good, go for it, Julie.
And I'm assuming that everybody's had sight of the report that was sent in and had chance to read it. Yes, yeah. And it's pleasing to see. I'm going to just pull out a few key points from it, which I've highlighted earlier on, not expecting to be in this situation. So looking at it, the results from 2019 staff survey showed a 5% overall improvement in the percentage of staff. Is she here?
Can you hear me now?
Oh, we can hear you.
Yes. Sorry, everybody. I don't quite know what on earth had happened to my
Saved by the bell. I'm going to
Saved by the bell.
Just speak up, Carolyn. That's all it is.
So thank you for the opportunity to come and talk to you. Julie's come for some moral support for me, but I've prepared what I wanted to talk to you about. I just wanted to draw the board's attention to a few points in the report, but recognising that this is out of date really now and doesn't necessarily reflect the current situation as CQC, because we've moved on a long way. But this is the data that we had from the last year's staff survey, and when we report back to you in October with our annual report, we'll have some more up-to-date data. But I mean, really, I think it builds on what the last discussion that you've just had, which I caught the tail end of it, really, because we have made a lot of progress. We had made progress even before the lockdown changed the way that we were working. And the last staff survey in 2019 demonstrates that. But also it demonstrates that we've still got a long way to go. You'll note in the report that there's some interesting demographic information in there, like men are more likely to contact the guardians for some reason than women. And given we have a lot more women in our workforce, that just seems a little bit at odds. And also you'll note from the report that suggests that more people from a Black and minority ethnic group have felt able to contact us. But we want to stress a real caveat around that, because we're not suggesting that everything is well in the world there for us in CQC. And we know that the work that has been happening lately just shows that people from a Black and minority ethnic group really do need more support to be able to speak up, and also that a lot of people feel that they're too tired to do that. What's the point in doing it? And that's why they don't. So just to put a caveat around what it says in the report around that. We've got our new guardians in place now. The three of us have started to gather a bit more traction and pace, and we have made contact with all of the different networks that we've got within CQC. So we've got representation from the three of us on those important networks. And then there's just one other thing that I just wanted to really draw your attention to. So CQC have been really supportive of the Speak Up role. We've got over 80 ambassadors trained, formally trained. We've got some more still to go through some training. So we'll have about 100 Speak Up ambassadors across the Commission. And then last month, around 30 ambassadors, including the new three of us as guardians, we all underwent a 2-day training course around mental health awareness. And that was a really good externally provided training event that helped us get some basic understanding of mental health, how we can support people more appropriately that are expressing concerns around their mental health, and how to signpost them. And we're really grateful that CQC supported that and invested in that, because we've got a lot more places for that. And hopefully we'll get all of the guardians, the ambassadors through that in due course. So yeah, just really wanted to update that we're cracking on and we're doing our best at the minute.
Great, thank you very much. I'm sure Julie was really glad that you were able to.
Sorry, Julie.
To get it, but that was good. Does any Ted, have you got your hand up? Oh. You're on mute though, Ted. That's it.
No, I'm off. Sorry, yeah, I have got my hand up. Carolyn, thanks for taking on this role, and Julie likewise. It's a very important role. I think one of the things we've learned from COVID-19 is the importance of speaking up, and so how can we make it successful? And I note from the survey that you quote, which I appreciate, is the last survey, only 47% of people, which was an improvement, but it said they felt that it was safe to speak up in the CQC, and I certainly personally felt that was a very disappointing figure. It's not in the current Pulse survey, so we don't know where we are at the moment, and of course sentiment has changed. It may have improved, but we don't know. I have to say, I do think this is just the kind of question that should be in every survey, because it's such an important test of sentiment in the organisation that people do feel free to speak. It reflects the kind of safety, transparency agenda which we've been strong advocates of. So can I just put a bid in for it to be in our regular Pulse surveys going forward?
Yeah, I think that's important. And Jill, and we haven't caught up yet with Jill as the Guardians, but that's something we want to do. Yeah, well, we know it has been quite quiet for the Guardians lately, although interestingly just this last week we've had a couple of things that have come up, and they've been very much around some HR type issues. At the London waiting, the phone always rings, doesn't it? Oh, at the wrong time. An issue around the London waiting, which is perhaps not surprising, and then some other sort of HR type issues that operational really that we're supporting with, but it is quite quiet really. The ambassadors are not getting contacted very much at the minute.
Okay, well, I'm sure Jill will hear what you just said, Ted. John, you wanted to come in? No?
Not me.
All right, Liz?
Thanks. Thanks for a good report. Good to see that Black and minority ethnic colleagues are feeling inclined to speak up, but I note very much your caution that we still have a lot further to go with that. I just wondered whether you know about other demographics amongst our colleagues, for example, disability or age. You've got mentioned ethnicity and gender here. Just a question. And the other thing I noticed in the report was there was some disagreement, wasn't there, some time ago about broadband, and it sounds very good that this has been kind of bottomed out. And I just wondered whether there's any information on how that learning is being taken forward. I know that Paul was involved in it. I don't know if he wants to say anything.
Yeah, thank you. I mean, we've got something in the report around the different age groups that more speaking up is happening amongst the under 50s, but I think we need to do more work about the different demographics and analysis of this, and we have got, I think we will get that more, because we've got one of the Guardians is Uma, which has got a background in intelligence and analytical data and things, so I think you can expect a bit more of that going forward. In terms of learning from the broadband, I mean, we haven't been hearing anything around broadband. None of us have heard anything of that since we took up the post at all. Nothing at all.
Thanks.
Hopefully that's a closed incident and an issue. Robert, you wanted to come in.
Thank you. Thank you very much for this report, and it's really encouraging to see three bright and enthusiastic people come taking over this role. Not that I'm suggesting they weren't there before. Excuse me. What I was interested to see was the large number of ambassadors you have, which I'm sure reflects a degree of enthusiasm for this agenda. But it contrasts a bit with what our registered providers do. I mean, most of them now do have ambassadors, but not in this number. And I'd just be interested to have a little bit of an idea of where all your ambassadors are and how they see their roles, and the extent to which any of them have any reserved time for the work that might come up, or whether that hasn't been necessary. Reserved time, yeah. Thank you.
Julie might help me out with this, because Julie is...
Yeah,
go on,
absolutely. Yes, I lead on the ambassadors. When I spoke to Mary about, why we had, actually it was a figure of 100 ambassadors, she didn't really know. It was a figure that she plucked out of the air at the time. And it's something obviously that we will, keep an eye on to see whether it's enough or whether it's too much. My thinking is probably it's enough. Most ambassadors don't get a lot of contact all of the time. Some do, some don't. Some probably in 2 years haven't had any contact at all. So what I tend to do is if Guardian's contacted, I will send out an email to all the ambassadors. Would somebody like to pick this up and contact this person, so that everyone gets a chance to volunteer to do it. The ambassadors are across all the directorates, so there is ambassadors in every area, but we've got quite a lot of work to do as to make that advertised better, so that people know where they can go within each directorate. So we've just started touching on that, because some ambassadors, like I say, have had no work at all, and some have more. So it's still something that we're working on.
Yeah. I think it's really important, if I say in an organisation as dispersed as ours is in normal times, let alone now, to have people readily accessible wherever the colleagues are, and that may be a reason for larger numbers than other organisations. But it may be that it actually points to a need to have people everywhere in a way that perhaps our providers don't.
Absolutely. Yeah, because some people will specifically want an ambassador from a certain directorate, or even from a certain grade, because they don't want to go to an ambassador who is also a manager. So we have ambassadors from all grades as well. So, yeah.
Okay, good.
Peter, it's Paul. Could I just perhaps respond to Liz's comment? I think what I would say, Liz, very, very briefly on that, is that where I came in was when the dust was beginning to settle, if not settled at that stage, and I did. My job was essentially to listen, I think, to what was being said and what the issues were, and we had a conversation around that as well. And I undertook to take away from that meeting to speak with Peter about what was coming out of that meeting, which I did, and fed back to him on that as well. I think what I've heard since, and indeed today, indicates that the lessons that were to be learned have been learned, and actually we've kind of moved on. And I think the term that was used to me by the Guardians was that the atmosphere has been reset since that, and there are learnings, but I think we've moved on from that. So yeah, I think that's great. So I hope that answers it for the board.
Thank you, Paul. Harriet, did you want to add something?
Just a very quick comment to Karen to say thank you, because as part of Carers Week last week we were running a series of engagement events, and she came and presented a fantastic session to kind of explain about the role of the Speak Up Guardians, and basically just to kind of get the awareness out there. And I know there was also some very, very positive feedback following engagement with the LGBT, sorry, I'm going to mix up those letters, but the other staff networks, and, to say thanks for the, the specific engagement with the equality networks on that. And, in response to Liz's comment from earlier, I think that's also going to be really helpful going forward in motivating kind of specific demographics, to give them the confidence to speak up in future. So although I can't pronounce the words, the Joint Network Voice is very grateful. So thank you. And, we look forward to continue to welcoming you as external speakers to other events that we're holding. So thanks.
Thanks,
Harriet. So thanks, Harriet, but thanks also, Carolyn and Julie, not just for coming to the board today, but actually for taking on these roles, because they are really important, and I think we're very grateful to you. So thank you, and we will see you in 6 months' time or whenever your next report is, if not before for some reason. But thanks again for all you're doing. It's really very much appreciated. And that moves us on, Liz, to update from the RGC meeting of yesterday.
Yes, thanks very much, Chair, and to those people who attended RGC yesterday. We discussed two significant issues. The first was the emergency service framework, the ESF, which has been touched on earlier. We wanted a deeper discussion on what had been learnt from it and what next. And I think what was really clear from that was that it was a very useful tool for this specific moment of how our service is managing during COVID. But going forward, that particular tool in that form wasn't going to be what we were going to need, but the digital platform underpinning it was had fantastic potential. So in terms of our future monitoring role alongside our inspections, really being able to widen the range of issues being asked about, the sources from which that evidence is coming, bringing together different sources of evidence really to improve our decision making. So lots of potential there. And we just thought that it was very important, once that further work has got underway, to have clear communication with both providers and citizens, so people understand the role that the ESF served and the role that the future tool will serve, so people don't confuse the two. The second item we discussed was just about services becoming more open again, or increasing their level of openness if they're already open, and how that's going and what the implications are for the CQC. And we just went through the different sectors really, so we kind of learned about some of the big issues in areas from, dentistry, how people are beginning to do dentistry in a very different way, with more gaps between patients arriving so that proper hygiene can be followed, through to the issues for people on waiting lists, for example, for elective procedures, and how to make sure that that waiting list management is done properly and people have good communication when they're on the waiting list. The workforce issues, if there are people absent due to isolation, or people in their families, etc., and so on. And so it's right across all the different sectors. We looked at all those issues, and really focused in terms of the CQC's role, infection control being obviously a major issue that is a big focus for us at the moment, and also understanding the innovations that have occurred, making sure that they're both amplified where they give great pointers to how things can be done in future, but also making sure they're done safely, so they're not the sort of innovations that actually place safety at any kind of risk. There was a lot more, but if anybody else who was there wants to add, please do. But I think those were the major issues.
Excellent, Liz. Thank you very much indeed. I'm not seeing anybody wanting to add anything. That was a good summary. So thanks very much. Any other business? Good. There was one question from a member of the public, but actually it was a question that related to a matter that NHS England, rather than ourselves, are responsible for. So we have redirected the questioner to NHSE. So there are no questions for us, which means that's the end of our meeting for today. Thank you all very much indeed.